Hi, I'm Andrea Cole, an implementation specialist at the Center for Practice Innovations, and we're partnering with NIAPers for this care management training initiative. I'll be teaching this module on taking care of ourselves as we help others. This module has 3 learning objectives. First, to understand the concepts of burnout and self-care. Second, to know why self-care is important. And third, to identify and practice self-care techniques. Let's begin with an example of a provider. Eddie is a care manager. He carries a caseload of 80 individuals who have mental health and physical health needs. He often arrives early to work and he leaves late, sometimes eating dinner at his desk. Eddie's partner complains that he's never home and states that Eddie is different since taking this job, more anxious and irritable. Eddie's having trouble sleeping at night and thinks it might be related to this job. Even though he's there all day, Eddie feels like he's not getting much done at work, and he's thought about quitting. So Eddie might be suffering from what is called burnout. Burnout is defined as a psychological syndrome involving emotional exhaustion, a tendency towards depersonalization, and a feeling of decreased efficacy on the job. Let's review these 3 aspects of burnout in more detail. For individuals working in the helping professions, burnout can result in emotional exhaustion. We may feel overwhelmed, sad, anxious, depressed, or hopeless. It may feel like a burden to go to work. We may also experience depersonalization, meaning we're not able to provide person-centered, empathic care to the individuals with whom we work. Finally, we may begin to have a reduced sense of personal accomplishment. We may not be able to see the value in our work or have the feeling that we are spinning our wheels or just going through the motions. The combination of these experiences is termed burnout. So who is at risk of developing burnout? Research has indicated that rates of burnout among mental health professionals can be over 50%. Burnout is higher among providers with large caseloads or those working with individuals with extensive and complex trauma. There's also system-level issues that contribute to burnout. These include increased documentation requirements, lack of time for training, and poor or infrequent supervision. Workers experiencing burnout may need to invest more time and energy into self-care. Self-care is the active and thoughtful engagement in behaviors that support health and well-being. So why is self-care important? Self-care promotes worker resilience in the face of stress. We will all experience stress in the workplace from time to time, and engaging in routine self-care helps to inoculate us against stressful situations as they arise. Self-care is also important because not engaging in self-care has been associated with compassion fatigue, lower energy, and worse problem-solving skills, all of which can lead to less than optimal care for individuals. Finally, some have argued that self-care is a professional responsibility. In order to provide the best services we can and stay in the field, we should invest time and energy in self-care. Engaging in self-care behaviors can be thought of as an empowering practice that allows providers to be active in deciding what they need to maintain well-being, both professionally and personally. Do you need to engage in more self-care? You may need to if you have lately been feeling tired, lack of energy, or dreading work, if you experience consistent insomnia or poor appetite, if you experience forgetfulness or poor concentration. Sometimes individuals manifest stress and burnout physically. You may feel chest pain, shortness of breath, or heart palpitations. You may notice yourself getting sick more often, or you may feel more anxious or depressed. Any of these experiences may indicate that you should try to devote more time and energy to self-care. The Substance Abuse and Mental Health Services Administration, known as SAMHSA, has recommended 5 self-care strategies. These are broadly to follow a healthy lifestyle, integrate wellness into everyday life, nurture social relationships, take care of your health, and seek professional help or support if needed. We'll consider each of these in more detail. Following a healthy lifestyle can include eating healthy foods, limiting drugs and alcohol, decreasing or quitting smoking, getting more exercise, getting more sleep, and engaging in rest and relaxation. Breathing exercises are an easy way to feel more relaxed. They are especially useful because you can practice at any time, even at work. Here's some basic instructions on a relaxation breathing exercise called the 4-7-8 exercise. It may help to practice these steps as I read through them. Begin by blowing all of the air out of your lungs. Then, breathe in slowly through your nose, counting to 4 in your mind. Hold your breath, counting to 7 if you can. Exhale the breath out slowly through your mouth, counting to 8 this time. Repeat this process for up to 4 breaths. Relaxation breathing is a great way to reduce anxiety and increase your sense of focus and well-being. It's simple and free, and you can practice multiple times a day. For example, when you feel stressed or when you're trying to fall asleep. The second recommendation from SAMHSA is to integrate wellness into everyday life. Self-care is not a once-a-month or a once-a-year activity. It can often be integrated into our daily routine. This includes addressing emotional and physical health on a regular basis, taking time each day to exercise, be alone, or practice mindfulness. It can be helpful to create a plan or a schedule to structure wellness and self-care activities into everyday life. Another aspect of self-care is nurturing social relationships to the extent you are able. Maintain your friendships and social life outside of work. Also, connect with colleagues or mentors at your work. Check in with friends and colleagues about how they manage their work-related stress. Perhaps they have a strategy that may work for you too. Just as we encourage individuals with whom we work to take care of their health, it behooves us to do the same as well. Schedule annual checkups and health screenings so that you are engaging in preventive care. If follow-up appointments are necessary, take the time to attend those as well. Your provider may have recommendations for how to handle an illness or other health issue. It may help to keep a list of those recommendations and to consider how well you may or may not be following them and why. Finally, if stress and burnout is impacting your mood, behavior, or health, you may consider scheduling an appointment with a professional mental health provider. Many mental health practitioners are adept at guiding those also in the helping profession to consider self-care techniques and address other aspects of our personal lives that may be impacting us at work. In addition, some find it helpful to attend a support group of people who are facing similar challenges. What are some ways to stay committed to a plan of self-care? It can help to tell others that you are embarking on a plan of self-care. Stating this intention and gathering support from those who are close to you may make it easier to stick with your plan. Scheduling specific times each day or each week may also help you to stick with your self-care plan. The strategies that are listed in this module are suggestions, but there may be other things that you find increase your wellness and health. Choosing an activity that brings you pleasure is important. Finally, journaling about your experience can be helpful. You may keep track of how you felt before your self-care activity and how you felt right after, noting any change. In addition to activities you may engage in to enhance personal self-care, there are steps you can take to engage in professional self-care. These are activities that may help to reduce the workplace stress you experience. First, discuss burnout with your supervisor. It's important to be open and honest about how the work is affecting you, while also maintaining professional boundaries in the meeting. It may also help to come to the meeting with some ideas you have for alleviating burnout. These may include reducing your caseload if possible, permission to use your vacation or personal time, requesting more consistent or structured supervision, and reducing the number of high-needs cases assigned to you. We may work with individuals who have experienced a lot of their own trauma, which can also lead to burnout. So maintaining a balance of individuals with whom you work can also be important for self-care. To the extent you are able, it can also be helpful to say no to optional tasks that may be asked of you, especially if you will not find them interesting or fulfilling. This can help to reduce the amount of time we are engaging in unnecessary tasks at work. If you find you've already said yes to tasks that are contributing to burnout, see if you can delegate them to others. This may free up more time for you to say yes to activities that you do find interesting and fulfilling. Another way to engage in self-care in the workplace is to take 15 minutes each day to ourselves. It can be hard to step away from the phone or computer or meetings, but taking 15 minutes to recenter may help you to be more productive and engaged for the rest of the day. Ideas include taking a walk, listening to music, eating with intention, having some coffee, or meditating. Finally, attending training or continuing educations for work can help to boost morale and remind you of why you chose to do this work in the first place. Let's return to Eddie, our care manager example. Eddie realized he might be suffering from burnout and decided to embark on a plan of self-care. He's decided he will only work 8 hours a day unless there's an emergency at work. He's also decided to start exercising before work 3 times a week. Eddie told his partner that he wants to engage in more self-care, and his partner knows that each night he plans to spend 15 minutes listening to relaxing music before bed, which Eddie has always enjoyed. Eddie plans to keep a journal detailing his self-care activities and how he feels physically and emotionally each day to document any changes. Other resources on self-care exist. Many apps have been created to help individuals implement self-care activities. These include Headspace, Gratitude Journal, Sleepbot, and Start Stretching. Also, the University of Buffalo School of Social Work has a self-care starter kit available online, which details how to assess self-care needs and to develop a self-care plan. So, in this module, we have discussed how burnout from workplace stress reduces quality of care and takes a toll on worker well-being. Self-care can help to prevent burnout. SAMHSA recommends 5 broad ways to engage in self-care. I leave you with a suggestion to think about how work affects you and consider creating a self-care plan. I'm Andrea Cole, and thank you very much for your time.